The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry. What's new? With us, we have two dentists, father and son, Dr. Ira Schecter and Dr. Michael Schecter. Welcome to the program.
How you doing, Randy?
All right. Now, what do they call you in your practice, by the way? They call you Dr. Michael. They call him Dr. Ira. What do they say?
Whatever they want, but usually it's Ira and Michael.
Now, you've been in practice for how many years? Over 30 years?
Since graduated in 1979, I've been in private practice since 1980 because I did a one-year surgical residency program before I went into private practice.
Okay, good. Now, before we get into today's topic, comprehensive dentistry, tell us about your practice. I mean, what kind of patients are you seeing? What's the wide range?
We actually see patients of all ages. We have little kids coming in, and we have geriatric patients well into their 90s even.
So you do everything, I mean, from dental implants, I guess you do fillings, cosmetic dentistry?
I think we really attract patients that are motivated by their health. You know, people that come in and they want to have healthy mouths, healthy bodies, and they come in seeking that comprehensive care.
Now, you both have nice teeth, right? Let's take a look at, very nice teeth. Now, your son, I mean, what role does he have in the practice? And
my son has actually been I think a great source of new energy for me. He's brought
How so?
Well, he's brought some new technology to the practice. He's introduced a whole new concept of treatment planning or treatment approach with respect to more preventative care. And okay. Michael can probably explain that better, but it's a great option that we offer our patients.
All right, now, we were talking off camera. You said probably the greatest compliment, I'm quoting you, about your son is that, if you go away and decide to retire, they're fully confident in his ability. I mean, you hear that? They say that?
They absolutely do, and you have to understand that the type of practice I've built, it's almost an umbilical cord that
okay.
I've remained connected with my patients. I don't shy away from treating my patients after hours if they need emergency care. My patients get my cell phone number as part of their post-op.
Is that right? Your
Absolutely. It's on the post-op sheet. And if I get a call in the middle of the night and I have to go in, which doesn't happen very often, I don't think it's happened really in the last number of years because we're very careful to try and prevent those type of problems, we deal with it. And the fact that now if I go away, and I'm doing a lot of traveling, teaching, and lecturing, Michael's there full-time. So patients are introduced to a different body, but the same philosophy and the same continuity of care.
Now, Michael, did you always know you wanted to be a dentist? You saw your father. Did you work in the practice?
Well, I think it's been just a gradual progression, right? I've always been interested in dentistry, interested in health, and I've slowly developed this idea where we can take a holistic approach to dentistry.
Are you a holistic dentist, a biological dentist?
I like to use
There's a lot of names for it.
I like to use the phrase biological dentist. I think it's a dentist that takes a comprehensive approach to dentistry, but does it from a science-rooted format.
I think, Randy, the important thing is that our patients get options.
Now, both of you are really into technology. I mean, all the new stuff.
Absolutely.
Does that make a big difference?
We've always been accused of being gadget guys. And I have patients who come in and they sit there and I have to get them to stop playing with the toys, as they call them, so that I can actually do the work. But I think the important thing is that we've always wanted to give our patients the best quality of care. And you can't deny that new technology, digital radiography, for example.
So all of this technology, is it for lower downtime? Better results, less pain?
I think it's a combination of things. The digital x-rays, for example, it's 50 to 90% less radiation than standard x-rays, so it's much less invasive for the patient. It also has eliminated the lead or chemicals that we need to develop the x-rays. In our office, we've eliminated the two major sources of waste in the dental office. We've gotten rid of the mercury from the amalgam fillings, and we've gotten rid of the lead packets from the digital
Does that still
x-rays.
go on, by the way, in Canada, the mercury or amalgam metal fillings?
Well, the controversy, I think, is worldwide.
But does it go on? I mean, are there still dentists that use those?
Oh, absolutely.
Oh, really? Okay.
And if you look at what's going on around the world, there's countries in Scandinavia that have banned the use of mercury amalgam fillings. It's still taught here in North America.
So
in
white
the dental
fillings?
Schools. We're using white fillings only, and I was actually the very first general dentist in Toronto. I'm proud to say that got on the so-called alternative filling bandwagon back in 1986, where I was commissioned to do an in-office pilot study by one of the manufacturers.
Now, Dr. Ira, you lecture to other dentists internationally. What are your topics?
Well, I've been teaching other dentists basically how to incorporate dental implants into their everyday treatment planning. But as well, I like to tailor my programs to the general dentist so that they can actually learn treatment planning skills as well. And they can learn how to think a little bit the way I practice, which is the best thing I can give an audience when I'm lecturing.
Now, what are some of the places that you lecture?
Well, I've been as far away as India. And
to other dentists there in India?
Other dentists. We had 300 dentists at a dental college in Hyderabad, India last year. And then I taught a 3-day postgraduate program to 60 graduate Indian dentists there. I also taught in other places in Delhi and in Mumbai.
So dentists from all over the world want to hear what you have to say in regard to placing dental implants, the surgical part, the restoration, as you put it.
I think it's the whole package. What we offer, or what I offer the dentists in my lectures, is what they could do. And they just have to learn, they obviously have to learn the technical skills how to place a dental implant, but more important than that, it's the treatment planning. They have to learn how to diagnose when to place an implant, when to extract a tooth, when to save teeth, when to combine implants with teeth. We today are really not robotic anymore about...
They don't teach this in dental school? I mean, did you learn the stuff that he's lecturing on?
I was going to say, I mean, as a continuing student of my dad's, I would say that he really gives you that thought process. And they give you the tools in school, right? They teach you how to place a filling. The implants hasn't really come to the university in Toronto yet,
okay.
but some of the other things they definitely show you. But in terms of taking a look at a mouth overall and saying, how do I want to plan to make this person healthier, more comfortable, able to chew, that type of comprehensive treatment planning just isn't available.
Okay. And do you go to his lectures, by the way?
Absolutely.
Do they bore you because he's your father?
Well, you know, a little bit maybe.
He only gets embarrassed when I introduce him to the audience.
Now, do you guys talk about dentistry when you're at home at the table? I mean, are you guys always talking about it?
We try not to, out of respect for everyone else, because it can be very boring. We understand for an outsider.
But you love it. I mean, both of you love it.
I've often said if I didn't have the passion that I have today to do what I'm doing, I would stop doing it, because then it wouldn't be fair to the patient.
Are people still afraid of going to the dentist, like this dental phobia? Do you hear that?
I think it's definitely still there. A lot of people are just plain phobic, like you say, about coming to the dentist. But we have different means and tools to make them more comfortable. I think the first thing is our approach. We're very approachable people, we're very calm, and we put people at ease in the chair.
I think patients develop a dependency on a lot of their professionals. And the fact that they can get mostly all of their dental needs taken care of under one roof, in one facility, with the same
So
deliverer.
that's your message. That's your message. I mean, this comprehensive approach under one roof, you could do it.
And then also in terms of anxiety, I mean, we have some additional tools to make the patient more comfortable. I practice homeopathy, and there are different homeopathic remedies that, while they're non-invasive and non-toxic, can trigger the body to heal, trigger the body to relax, and allow the procedure to be a lot more comfortable.
Is it less painful, even in the last 5 years, is it less painful to dentist than it was 10 years ago today? Is pain almost behind us now?
Pain is unnecessary.
Okay.
And the problem is that when people experience pain, tooth pain is horrific.
Okay.
And they usually experience tooth pain because they've allowed things to be neglected to the point where the disease process has invaded the nerve space of the tooth, or the infection that's around the tooth has become so profound that they can't tolerate the pressure that it's eliciting. And really what we're trying to do in building our rapport with our patients is to get them to address what they perceive to be something abnormal right away. And if there's even the slightest concern, we want them to contact us.
So in Toronto, are there people out there that have tooth pain that are just living with it because of the fear of the dentist, and they don't realize that they could go in and it's gone?
Absolutely.
Is that an overstatement, that they could go in and you could help take that away?
We can get rid of pain
make them
instantaneously. We can get people comfortable. We can, as long as we have the opportunity to assess it, to diagnose it, and to figure out what's going on. We'll deal with their emergency situation right on the spot. We'll never turn away an emergency. And then what we do is we try and get them to come back so we can do a comprehensive assessment of everything else that's going on.
That's why I'm clear. Are there certain things I mean, how do you divide the patients? Are there certain things you do that he doesn't do?
We work together, and it depends on what the problem is. So for example, if somebody comes in with a missing tooth, and they are interested in having an implant placed. We don't just say, we'll just put the implant in, but we'll actually take a step back and say, why are you missing this tooth? What type of disease is present? And perhaps we'll take a slide, we'll investigate the specific bacteria that's in the mouth that's causing the tooth loss or the tooth fracture.
How do you do that?
We have a microscope, and it's really quite simple. It doesn't hurt. It's very easy. We just take a little sample of your plaque right out of the mouth, look at it together on the microscope, and we see
together
what's
with
there.
a patient.
There's a big screen.
Could you see a live something going on? So you call that a chairside?
It's chairside microscopy. And basically what it is it's a microscope. And it's new technology that's allowed us to do this, but we can just look at everything live. And it's very exact.
So you see it on a film, and then what?
And then we make a specific treatment plan for you.
You can kill that?
We can kill that stuff. And the whole idea, what we're trying to do is incorporate the health of the body into this. So we're not trying to use harsh pharmaceuticals or chemicals, but we're trying to use more gentle herbals or homeopathic
like
remedies.
Rinses and things like that are shot into the mouth?
Different rinses, and you also have to incorporate a systemic or a whole body approach to this. So while there are rinses to use to kill the stuff that's in the mouth, 90% of the time, if you see stuff in the mouth, it's also in the body.
And at the same time, we don't lose sight of why the patient came in. So patients come in and they have a specific problem that they perceive, and may be different than the problems that we're going to be presenting to them.
Right.
We will address that problem. So if they have a fractured tooth, and it has to be extracted, and it will be.
So you fix the problem.
And we'll address the problem. We'll fix it with a temporary solution before we get into a final solution, and we will then get them on to a more comprehensive assessment of what's going on in their mouth. And again, it's about giving the patient a choice, and they can elect to follow our plan, or they can elect to just do part of it, or just deal with the emergency.
Are you guys the best father and son team approach in all of Canada, by the way?
I'd have to say so.
You'd have to say so. Okay, good. We're going to take a quick break. And you know, we'll have to have you back on the show and give you a full half hour discussing this biological dentistry that you're doing. So, a pleasure to meet you.
Pleasure, thank you.
And we'll come back and we'll talk more about some of your cosmetic and what you need to know about dental implants as well. Okay? You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, all about what's new with dental implants and cosmetic dentistry. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry. With us, we have internationally known dentist, Dr. Ira Schecter. Dr. Schecter, welcome to the program. I mean, you are internationally known. You lecture, you teach other dentists.
I do, Randy.
For those just tuning in, tell us about that.
I got into lecturing in the mid-90s to share my approach to patient care, to be able to give other dentists the enthusiasm, the motivation, as well as the technical skills to be able to implement into their everyday practice what we do at our practice.
Now, you're considered, you consider yourself a gadget guy.
I do. I try to, as I said, give my patients the most optimal care with the latest in technology. We are completely computerized in the office. We're automated in every operatory. We have a digital panoramic x-ray machine, digital radiography, chairside microscopy, as Michael explained. We have the latest in rotary filing for endodontic therapy. We offer patients all kinds of choices in terms of their
So you do
treatment.
everything, I mean, under one roof.
We do.
Is that what comprehensive dentistry is?
It is, and we also like to refer to ourselves as the quarterback of our patients' needs. So
what does that mean?
Well, it means that if there is something that we can't do, if a patient needs a procedure that requires a general anesthesia, we will refer them out, and if we refer them out, then we will make sure that we're on top of the treatment.
Okay, now, people normally don't like going to the dentist. I spoke to your son, who's also a dentist in the practice. He said they like going there. They like going to the dentist.
They do.
Is that right?
We try and offer a comfortable environment, from the waiting room right through to the treatment rooms. We have continuity of staff. I've had the same receptionist, office manager for 24 years. I had the same hygienist for 24 years. They started together with me when I opened the practice.
Okay, so you brought some of your work.
Pictures are worth 1,000 words, right?
All right. Okay, so what are we looking at here?
Well, I wanted to bring in a case here to show you, which is typical of a patient who came to me on referral with complex issues. And his number one concern, though, was he was going to a dentist for years where he just felt he wasn't getting treatment. And he knew he had problems. He was losing teeth were breaking, he couldn't chew properly.
So this is not just a cosmetic problem?
No, this is a functional problem. Okay. I mean, we look at it and we see space between the teeth, we see ugly teeth, we see short teeth. He couldn't smile nicely, he didn't have the same esteem that he really deserved.
Do they avoid smiling, by the way? I mean, do you hear that on these consults?
All the time. When we
ashamed of their teeth?
When we finish treatment, patients tell us they can't stop smiling. They walk by mirrors and they smile all the time. People don't realize what they don't have till they don't have it.
Now, in this one, you say complex. Okay, so beyond the gaps and the spaces, what else was going on, and what were the options?
Well, this fellow had, he wanted to arrest his tooth loss. And he felt like every time he went to the dentist, all they did was take out the hurting tooth or the broken tooth. And he didn't want to do that anymore. He said he had the means to fix it, but he needed a plan. And in a matter of 6 months, we restored him so that he had virtually every tooth in his mouth.
So what did you do for him? I mean, what am I looking at this after? That's very nice.
You're looking at porcelain crowns, you're looking at some porcelain veneers, you're looking at multiple implant placement. I think I put about 8 implants into this fella in every quadrant of his mouth.
So nothing's removable in this
No.
one? It's like he got his teeth back?
He's got his teeth back, he got his smile back, he got his esteem back, and he's happy.
They say that to you? I mean, they're happy
all the time, Randy.
Just because of their teeth?
You know, and you and I can't appreciate it because we have our teeth, and we've taken care of our teeth, and our teeth are important to us. But again, so many people, they lament the fact that they don't have their teeth when they lose them. And when we give them, remember, God gave us 2 sets of teeth, a set of baby teeth and a set of permanent teeth. Dentistry now has the ability to give people a 3rd set of teeth, and it's their last kick at the can.
Interesting.
So if they don't take care of that 3rd set of teeth, they're not going to have another choice. And then they're going to be into a removable...
So with dental implants you're talking
with
about?
With dental implants.
Give them their teeth back.
And today it's proven. It's proven that biologically, physiologically, functionally, it is so much healthier for a patient to have dental implants supporting false teeth than to start bridging and cutting down healthy teeth to make a bridge to replace those missing
You've been
teeth.
in and around dental implants since about, what, 1982?
Since its inception, Randy. I happen to be fortunate, I say, to be in the right place at the right time.
Did you know right away? You said, I like this implant
I got to
stuff.
tell you something. You know what? It was one of those things where the wow factor. You guys in the media business talk about wow. That wowed me. And I sat there at the back of the room, and I was mesmerized. And I never got so enthused about anything. And I was only a couple years out of school.
So respectfully, though, to me it seems like a boring topic, dental implants. But I mean, why were you so wowed by the?
Because the thing that I learned very quickly in practice was that I was not feeling gratified by the removable prosthetic part of my practice, the denture part of my practice.
Interesting.
And it was the type of thing where we worked really hard to give patients tooth replacement with a removable entity, whether it's a complete denture or partial denture, but it was always a short-term fix because we didn't appreciate the fact that the minute they got this denture, 3 months later their tissue that's supporting this denture is going to change. And if it was a partial denture, the partial denture would create adverse wear on the supporting teeth so that it became a domino effect that then they would lose more teeth and you'd have to constantly be fixing this band.
So implants you saw as a way to get your
Initially I looked at it as a way to stabilize a removable prosthesis. That's the way it was.
So how is it better now than it was
because
back
now
then?
it's done for everything in the mouth.
And you say as little as one appointment or in the same day?
We basically today can give patients a solution instantaneously. They can walk into our office at 8 o'clock in the morning. They can have no teeth. We can place implants. They can have a temporary, permanent, fixated restoration put in their mouth by early afternoon. They can go home. Freezing will have worn off. They'll have minimal pain.
So they don't complain about pain very often?
Very little. Very little. To be honest with you, an Advil product or anything similar to an Advil is more than enough to control the pain. And they can go have dinner that night.
They could eat that night with these teeth?
They can go eat and have dinner that night.
You say imaging.
And I'm not making this up. I had a patient last year who was a very, very high-profile lady who was an international business lady who was scheduled to have dinner that evening with the Undersecretary General of the United Nations, who happened to be in Toronto. They were doing some international business deal, and she called me from the restaurant to tell me that she was eating dinner with her immediate temporary teeth that I placed 5 hours earlier.
Interesting.
Okay, and Randy, here's another case that I wanted to show you that illustrates what the type of patient we see. And again, this is very unsightly for someone like you or I, but unfortunately there are people who walk around looking like this.
Do they hide their teeth? They don't smile?
They don't smile. They have no esteem.
So in this case, their teeth had to go?
This case, we did a total assessment of every single tooth in the mouth from a functional point of view, a periodontal point of view, a root canal point of view, and we gave the lady options, and she elected to go the implant route. And she decided to have all her teeth taken out and replaced by fixed implants, meaning she didn't want any denture, she didn't want anything removable, she wanted it fixed in place. And we were able to give her something like this, which is a fixed restoration top and bottom.
So clean. I mean, look how clean that looks.
It's unbelievable.
How is it that the gums are cleaning up?
Because the one difference between a dental implant and a tooth is the dental implant is fused with the bone. A tooth is held in the bone by a ligament. And it's the ligament space that gets potentially infected and contaminated and diseased when the patient's neglected. With dental implants, as long as patients maintain it, the bone level remains stable, everything's a lot cleaner. And then the patient can now smile and look like this. And that's an
nice.
Unbelievable improvement.
Makes them look younger.
To be able to do something like this, you have to have the guided computerized technology where we can actually pre-design the cases with the computer program, and we can make ourselves templates so that we know where to place the implants. We take the teeth out, we place the implants right away, and we give the patient a pre-made temporary. So we make the temporary from our original scans in the office, and then we can go ahead and insert them.
Okay.
Patients walk out with a set of teeth.
How old is too old for dental implants?
There is no age, and age is a chronological number. It's really the health of the patient.
But realistically, I mean, what are your older patients?
I've placed implants on 88-year-olds.
88 years old?
88-year-olds. And I have a lady now who has a problem with the tooth. She has all her teeth. She's 96 years old. Now, I'm doing everything I can to save this tooth because I don't want to do surgery on this lady. But she said to me, well, if worst comes to worst, you can put an implant in. So age is a number. It's the health of the patient.
So even at 80, that implant will stay?
Absolutely, as long as there's enough bone and the bone is healthy. And the patient is healthy enough to withstand the surgical procedure.
What if they have osteoporosis?
Osteoporosis is not a contraindication to placing dental implants.
You say 4 implants, by the way, can give somebody something secured in their mouth.
You could have 2 implants and give the patient an immeasurable improvement with their removable prosthesis.
Like something that snaps in.
Snaps in and snaps out.
But if it's as good as you said, why aren't the denture wearers doing it? All of them saying, okay.
Ignorance, cost.
They just don't know what's available.
Ignorance and cost. And probably more ignorance and cost, because the quality of life improvement that we give patients for the denture wearers or the edentulous patients or even the partially edentulous patients is immeasurable.
But even 2 dental implants, you're saying, that can't cost very much.
No. I mean, it's expensive.
They need to know their options.
But they need to know their options.
Okay.
And the issue really is patients have to be informed. Unfortunately, there's so many dentists out there today who themselves aren't informed enough. So if they don't have the information or they don't have the confidence, then they can't.
In the U.S., I've had a dentist that, knowing you were coming on the show because you lecture on the topic, and this periodontist said you can't, 4 implants, can't give something fixed in the mouth. This was less than 2 months ago.
And that's not true.
But is that a common belief, you think? That some dentists,
let's
say in the U.S.
There's a technique that's been developed today by a well-known implant dentist from Portugal.
So it's new. Is this somewhat
It's not new. It's been around for a number of years where we could place 4 implants in the lower jaw. He actually will do it on the upper jaw too. I'm a little bit more conservative. I like to have at least 6 implants on the upper jaw to have a fixed
So do people,
case.
do you think, count their teeth and think, That's a lot of implants. I can't afford it.
Well, I think people, again, have to be educated. They don't need one implant per tooth loss. So you can actually place on the upper arch 6, 8 teeth, 8 implants, and replace 14 teeth. On the lower jaw, I've done cases with as little as 4 or 5 implants. 6 is ideal, never more than 6.
It's hard to believe the downtime is so low. We are out of time, but we have time for a few more photos.
So here's a young lady who came to me with 2 retained baby teeth. She was congenitally missing her adult teeth. These teeth are ready to fall out. And we in turn replaced her with 2 dental implants, and you can't tell the difference. If I challenge you, if I wouldn't show you the first
So the 2
photo,
next to the front 2 teeth are dental implants.
they're dental implant supported crowns. And they
so
look
her
real.
option what? Would have been something
Her option would have been to remove the teeth and have a flipper or some type of a bridge connecting to the adjacent teeth. But then you would have had to cut down perfectly healthy, what we call virgin teeth. And that's a crime today.
Okay, we have time for one more photo, so I guess we'll ask you to pick your best one here.
Take a look at
this.
You
like this stuff.
I love
when you
this
look
stuff.
at these photos, that's
I
good.
tell you, this is my whole life in front of me in photos, and my professional life at least.
All right.
But here's a guy, and I just don't know how someone can walk around like that. I mean, you look at that, you can't even tell the difference between his top teeth and his lower teeth.
It's terrible.
He has no upper back teeth. He's got 4 front teeth, and he's got missing probably 3/4 of his lower teeth.
But there are a lot of people, by the way, out there like this. You just don't see them because they don't smile.
They don't smile, or they just hide everything with their lips.
Why
they
did
grow
this person
mustaches.
wait so long? Why do they wait so long? Just afraid of the dentist?
You know what? No, I think that he was going to a dentist. He had dentures, and he just kept losing more teeth. The dentures didn't fit anymore, and his dentist couldn't help him. His dentist just didn't know what to do. And luckily for him and for me, he found me. And then he looks like this, and it's night and day. I mean, you just can't compare it.
I want to thank you for coming on the show. Very good.
Thank you so much.
Great information. So it all starts. So somebody out there, they're missing teeth, or they're unhappy with their smile. What's your final message to them?
Go see your dentist. And find a dentist who really is current and can address all of your needs, and make sure that you're satisfied with the solution.
And so you do the consults, or your son?
We do.
They'll meet you?
Absolutely. Any patient is free to call us. We have an open practice for new patients, and we just love the challenge, and we like to help people improve their esteem, their function, their aesthetics.
So don't put it off.
Don't put it off. You know what? We work in millimeters as dentists, and every millimeter to us is critical. So patients, if they lose teeth, they lose bone. And if they lose too much bone, that's when you have the problems, which sometimes make the challenge more.
So treatment earlier rather than later.
Absolutely.
Okay, thanks again. Very good. Very good. And we're going to have your son on the show to talk about more things, some of the holistic things that he's doing. So thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.